Welcome to Module 1 of the Phase 1 volunteer training for the Wildlife Center of the North Coast. So this first module is going to cover just some of the basics of what makes the clinic here at Wildlife Center of the North Coast work and what are some considerations new volunteers should keep in mind when coming on to help with animal care here in the clinic. Most of the information here is designed for animal care volunteers as opposed to maintenance volunteers or educational outreach volunteers. The information here is going to be primarily designed for people who are working with wildlife in a hands-on capacity. As you get more familiar with how the clinic works, it will appear more obvious what the general workflow of a given shift is, but I did want to give a little bit of an overview of that here also. So there are typically 3 potential shifts that you might work during the day. There's the AM shift, which is 9 a.m. to 1 p.m. There is the midday shift, 10 a.m. to 2 p.m., which not as many people tend to do. We just have a handful of volunteers doing that shift throughout the week. And then there's the PM shift, which is 1 p.m. to 5 p.m., and that's the closing shift. So depending on which shift you are on, there'll be sort of particular tasks that tend to be a part of that shift, and the rehab staff that you're working with will help you get to know the workflow of that shift. But a few notes about that. One good way to start when you show up for your shift in terms of getting a sense of what the shift workflow is going to look like will be to take a look at each of the patient care boards in the clinic area to just get familiar with what patients are in care right now, what the general needs of those patients are, what the general treatment plan looks like. In a later module, we'll go over in more detail what the abbreviations on the boards mean and all those kinds of things. But just to get a sense of, how many patients are in care so that you know how busy the day is likely to be. It's just a good idea to kind of get the broad outline of what to expect while you're here. You'll also want to take a moment to look over the daily care log that the rehabbers are using, and that will allow you to see which tasks are planned for the shift and to see what's going to need to be done while you're here. The rehabbers will also go over the daily care log with you and are likely to pull whatever tasks they assign to you from that, and will explain more about how to use it. Expect that if you're here for an opening shift, there's usually a time in the morning before everybody really gets to work where the clinic staff will go over the boards with you and talk about the patient care plans and the patient load and what the plan for the morning is. It's kind of like rounds at the hospital. So if you're here for an opening shift, expect that will likely happen before everyone really gets started. And if you're here for a closing shift, expect that before the end of the day when people leave, you'll be helping with the closing shift tasks, which are on the clipboard over by the phones. It's a checklist of things that need to be done in order to close up the clinic for the evening. And if you're a closing shift person, you should expect to help get those all done before it is time to leave for the day. So the next thing to talk about is the clinic environment here at Wildlife Center of the North Coast and some of the important considerations that come along with creating the right kind of clinic environment for optimal patient care, optimal patient health. So this section is called the clinic environment, important considerations, also known as these animals would really prefer to be elsewhere. And the reason that I say that they would prefer to be elsewhere is because animals typically end up in the clinic because some part of wild living has not gone well for them. They may need our help, but this doesn't mean that the situation they find themselves in is any less stressful or scary. We know that they need help. They may not realize that or feel that way at all. So what does help to minimize patient stress is us here in the clinic environment modifying the environment to be more sensitive to the needs of the animals. And anybody working here in the clinic doing animal care tasks should be really aware and constantly mindful of minimizing the amount of disruption and stress that we are forcing patients to experience over the course of the day as we work with them and help them. There are some fairly easy and very concrete things that we can do to make sure that the clinic remains a healing environment for the animals that are here under our care. So the first thing that we can do is remember to use a quiet voice when talking to other people, especially if you are in the main areas of the clinic near animal enclosures, or if you are in a situation where you're helping with hands-on patient care. So using quiet voices, minimizing the amount of talking you're doing in times when you're actually handling animals, those types of things can help to lower the overall noise level in the clinic, and that can be really helpful for the animals. Don't make eye contact with the animals. So for a lot of wild animals, and even some domesticated ones, direct eye contact can be seen as really threatening or challenging, and is just not something that you want to be doing. So it's okay to look at the animals. Obviously, we need to do that as part of our care, but making prolonged eye contact is not a good idea. Don't play music or make other loud kind of people noises around the animals. We ask that you put your cell phone on vibrate or in silent mode. That sort of text message notification dinging noise is something that just anecdotally I can tell you animals really don't like. So if you can just minimize your sort of general noise level as a person with all your person things, that's really helpful. Remember that our goal is to interact with and handle the patients only when necessary, so that we're disrupting them as little as possible and minimizing the amount of stress they experience. You know, despite our best intention, most of these animals likely consider us a potential source of danger or harm, and they find us scary. So we know we're trying to do what's best for them, but they don't necessarily feel that way. And minimizing the amount of contact they're forced to have with us is really helpful in keeping their stress level low so that they can heal as well as possible and as quickly as possible. So just to kind of summarize this little section here on the clinic environment, I wanted to mention a little bit about just the overarching ideas behind providing an appropriate patient environment. And obviously, just like people, any creature receiving medical care needs a clean and safe place to be able to recover. And we want our clinic to be that place. So providing our patients with excellent care means giving them a quiet environment, good nutrition, and minimal contact with people, like we talked about. And we also encourage everyone, staff, volunteers, to treat the clinic like a medical facility. So we want to ensure that surfaces are clean, garbage is disposed of properly, dishes and laundry are not allowed to pile up excessively. Keeping the environment clean and easy to navigate is an important part of providing excellent patient care. And so that's why some of the tasks that we all, as people working here in the clinic, do are very kind of mundane, dishes, laundry, cleaning kind of tasks, because keeping this environment clean is a good way to keep patients healthy by preventing disease from spreading, and by making sure that the patients are in the best possible environment. Part of providing a clean clinic environment where animals can heal is also making sure that our general human hygiene is well attended to. So that brings us to hand washing. Hand washing is something, obviously, that the entire world has been talking about all the time for the last couple of years, since we've been having a big pandemic and whatnot. But it is really important, as much as maybe it feels like we've discussed it to death. So good hand washing is one of the best ways to protect yourself and also to keep patients safe. So there are plenty of pathogens that can go back and forth between people and animals. But if you are taking the appropriate precautions, those shouldn't be things you have to be really worried about here. So please wash your hands regularly during your shift. Be especially sure to wash your hands after coming into contact with anything that may have touched an animal, or after you've touched materials that have come out of an animal's enclosure. And wash your hands well with soap and water before leaving the clinic at the end of your shift. Some volunteers also like to have different clothes that they wear here for being at the clinic and doing animal care. Obviously, anybody who's had a fish slurry accident knows that this can be a really messy job, and so you may want to also consider having clothes that you wear here that are kind of dedicated to the project and you're not trying to keep them clean or nice. But above all, making sure that you're doing really good hand washing is something that we want to emphasize. The next piece of the general hygiene is gloves. So gloves are available throughout the clinic building. They come in a variety of types and sizes. You should be able to find something that fits you. We'll talk later in a later module about things like leather gloves for handling raptors and things like that. For right now, what I want to talk about is the disposable latex gloves that are in cardboard boxes around the clinic. So they come in small, medium, large, extra large. One of those should fit you. Figure out which size is best for you because you are going to be wearing them all the time. Gloves should be worn for any handling of wildlife, cleaning of enclosures, or preparation of diets. And there are a lot of reasons for this. First and foremost, a lot of the stuff that you're going to be touching is really gross and it smells really bad, and wearing gloves prevents you from smelling like those things. But wearing gloves can also prevent you from getting pathogens or other things on your hands that you don't want to have there. And it's also to help protect the animals from us. So if you are touching something that has touched wildlife, you should be wearing gloves here in the clinic. So, like I said, wearing gloves helps to protect you from pathogens that the wildlife may be carrying. But gloves also help to protect the wildlife from us as humans. Some of that is, the potential that we could carry a pathogen that's unhealthy for them. But there's also the really important fact that a lot of the animals who are patients here at Wildlife Center of the North Coast are birds. And birds need to have waterproof feathers in order to be releasable. This is obviously especially true for seabirds. And in order to be waterproof, they need the right kinds of oils on their feathers. And those oils are not the oils that come from human skin. So the oils on our human skin can compromise the natural waterproofing of a bird's feathers and therefore delay their recovery and their release. So when we touch birds without gloves, we're basically compromising the thing that will allow them to become releasable in the near future. And that's not something that we want to do. So it's really important that you wear gloves when handling birds, and that before and after you put those gloves on, you make sure that your hands are clean, and that anytime you have been handling wildlife here at the center, you make sure that you are washing your hands afterwards. So that brings us to the end of Module 1 of the volunteer training. And what you'll do is, after you have watched this video and then had a chance to check in with clinic staff about your volunteer training checklist, you can have this piece of things signed off. All right. Thanks for watching.